Imagine waking up one morning with bright red rashes spreading across your skin. You know you need to see a doctor, but which one? Or picture this, you trip, fall, and hear that awful crack. Your leg is broken. Again, you need a doctor, but not just any doctor. The truth is, the medical world is vast, and different doctors are trained to handle completely different problems. Knowing which specialist to visit can save you time, stress, and sometimes even your life. Today, we're going to break down the most common types of doctors, what they actually do, and how to pronounce their names correctly. By the end of this, you'll never be confused about where to go when something goes wrong with your health. So let's dive straight in. The first type of doctor on our list is the general practitioner, and this is probably the one you're already most familiar with. A general practitioner, often shortened to GP, is what most people refer to as their family doctor. Think of this person as your first stop for any everyday health concern. Got a sore throat that won't go away, dealing with a stubborn stomachache, suffering from a pounding headache, or a runny nose that's been dragging on for days. These are exactly the kinds of issues a general practitioner handles. They're trained to diagnose and treat a wide range of common health problems, and they're usually the ones who refer you to a specialist if something more serious is going on. So whenever something feels off but you're not quite sure what it is, your GP or family doctor is always the right first call. Now, moving on to the second type of doctor, the dermatologist. The name might sound complex, but the role is straightforward. A dermatologist is a doctor who specializes in everything related to your skin, your nails, and your hair. So going back to that scenario from the very beginning, those alarming red rashes spreading across your skin, a dermatologist is exactly who you need to rush to. Whether it's acne, eczema, psoriasis, hair loss, or nail infections, this is the specialist who handles it all. Skin is actually the largest organ in the human body, and yet it's one of the most overlooked when it comes to medical care. A dermatologist ensures that this crucial part of your body gets the proper attention it deserves. So the next time you notice something unusual on your skin, don't ignore it, book an appointment with a dermatologist right away. Next up is a doctor that almost everyone has visited at least once, and for many people it's not exactly a pleasant memory. We're talking about the dentist. Dentists are medical professionals who specialize in the human mouth, and their work goes far beyond just pulling out teeth. They diagnose and treat issues related to your teeth, your gums, and your overall oral health. Now, you might be wondering how often you actually need to visit one. Well, medical experts consistently recommend that every person should see a dentist at least twice a year, even if nothing seems wrong. Regular checkups help catch problems early before they turn into something much more painful and expensive. Oral health is also closely connected to your overall health, which makes those routine visits even more important. So if you've been putting off that dental appointment, consider this your reminder to finally book one. From the mouth, we now move to the most vital organ in your body, the heart. The specialist who deals with your heart is called a cardiologist. A cardiologist is a doctor who focuses on diagnosing and treating diseases of the cardiovascular system, which includes your heart and blood vessels. If you're experiencing chest pain, irregular heartbeats, high blood pressure, or any other heart-related concern, a cardiologist is the doctor you need to see. Now, here's something worth noting. As important as cardiologists are, there is one thing they simply cannot fix, and that's a broken heart in the emotional sense. When a relationship ends and you're left feeling devastated, no amount of medical expertise can mend that kind of pain. But for every real, physical cardiovascular condition, a cardiologist is your go-to specialist, and their work genuinely saves millions of lives every single year. Now we come to a specialist that plays an incredibly important role in women's health, the gynecologist. A gynecologist is a doctor who focuses on the female reproductive system. Whether it's routine checkups, hormonal issues, or concerns related to reproductive health, this is the doctor women turn to. You'll often hear people use the shortened term gynec in everyday conversation, and that's perfectly acceptable. However, it's important to understand the distinction between a gynecologist and an obstetrician. While a gynecologist manages the overall health of the female reproductive system, an obstetrician is the doctor who performs surgeries in that area, including cesarean sections and the removal of ovarian tumors. So to put it simply, the gynecologist is your primary doctor for reproductive health, while the obstetrician steps in when a surgical procedure becomes necessary. Let's shift focus now to something many people deal with on a daily basis: vision problems. If you've ever struggled to read a sign from a distance, or noticed that your eyes feel strained after long hours of screen time, then the doctor you need is an optometrist. An optometrist is an eye specialist who diagnoses and treats a wide range of vision-related issues. Whether you're dealing with blurry vision, eye infections, or simply need a prescription for glasses or contact lenses, an optometrist is the right professional to consult. People often confuse optometrists with ophthalmologists, but the key difference is that ophthalmologists are medical doctors who can also perform eye surgeries, while optometrists focus primarily on vision care and eye health management. Either way, if something doesn't feel right with your eyes, don't delay. Your vision is one of the most precious senses you have, and protecting it should always be a priority. Now, remember that scenario from the very beginning, the broken leg? Here's the doctor who would actually fix it. An orthopedic surgeon is a specialist who deals with the entire skeletal system. Bones, joints, ligaments, tendons, everything that gives your body its structure falls under their expertise. So whether you've fractured a bone in an accident, torn a ligament playing sports, or are suffering from chronic knee pain as you get older, an orthopedic surgeon is the person who can help you get back on your feet, quite literally. Arthritis, a condition that causes painful inflammation in the joints, is also commonly managed by orthopedic surgeons. As people age, joint and bone issues become increasingly common, making this one of the most frequently visited specialties in the medical world. So if anything goes wrong with your bones or joints, you now know exactly who to call. Next on the list is a doctor whose workplace looks a little different from most: colorful walls, cartoon characters, and toys scattered around the waiting room. That's the environment of a pediatrician. A pediatrician is a doctor who specializes in the health and development of infants, children, and teenagers. From the very first days of a newborn's life all the way through adolescence, a pediatrician monitors growth, administers vaccines, treats childhood illnesses, and addresses developmental concerns. The child-friendly atmosphere in their clinics isn't just for decoration. It's intentionally designed to make young patients feel safe and comfortable in what can otherwise be a frightening setting. If you're a parent, a pediatrician becomes one of the most important doctors in your life. And building a good relationship with one early on can make a tremendous difference in your child's overall health and well-being. Now we come to a doctor that people frequently confuse with others, so it's important to get this one right. The urologist is a specialist who focuses on the urinary tract system in both men and women, as well as the male reproductive system. This means that if you're experiencing urinary tract infections, kidney stones, bladder issues, or any problems related to the male reproductive organs, a urologist is the correct doctor to see. Here's where a lot of people go wrong. Many men assume that if they have issues with their reproductive health, they should visit a gynecologist. But that's not accurate at all. Gynecologists deal exclusively with the female reproductive system. For men with reproductive health concerns, the right specialist is always a urologist. Clearing up this confusion is important because visiting the wrong specialist not only wastes time, but can also delay proper diagnosis and treatment. Closely related in name but very different in function is the neurologist, and this is one specialty that's often misunderstood simply because of how similar it sounds to urologist. A neurologist is a doctor who specializes in conditions related to the brain, spinal cord, and nervous system. If you're experiencing severe migraines, seizures, memory loss, or any kind of nerve-related issue, a neurologist is the expert you need. They use a combination of physical examinations, patient history, and diagnostic tests to identify what's going wrong within the nervous system. Now, when a condition requires actual surgery on the brain or spinal cord, the doctor who steps in is called a neurosurgeon. Just as we saw with gynecologists and obstetricians, there's a clear division here. The neurologist manages and treats neurological conditions, while the neurosurgeon operates when surgery becomes the necessary course of action. Understanding the difference between these two roles, neurologist and neurosurgeon, is incredibly useful, not just for your own health awareness, but also for conversations in everyday life. Imagine watching a medical drama on television or reading a news article about a brain surgery. Knowing what these titles actually mean gives you a completely different level of comprehension. And that's really what this entire lesson is about. It's not just about memorizing a list of doctor names. It's about building the kind of vocabulary and understanding that makes you more informed, more confident, and better prepared when real health situations arise, whether for yourself or for someone you care about. Let's take a moment to look at the bigger picture here, because what we've covered so far is really just the surface of an enormous medical world. There are dozens upon dozens of medical specialties out there, each one dedicated to a specific system, organ, or age group. We've touched on the most common ones, the specialists that the average person is most likely to encounter at some point in their life. But the underlying principle remains the same across all of them. The human body is incredibly complex, and no single doctor can be an expert in all of it. That's precisely why specialization exists. Each type of doctor spends years, sometimes over a decade, studying and training in their specific field so that when you walk through their door, you're getting the most focused and informed care possible. Think about how this knowledge can change the way you respond in a medical situation. Before, if someone mentioned they had an appointment with a dermatologist, you might have nodded politely without fully understanding what that meant. Now you know it's a skin, hair, and nail specialist. If a friend tells you their child was referred to a pediatrician, you understand exactly why. If someone's grandmother is scheduled to see a cardiologist, you know that involves her heart. This kind of awareness doesn't just help you understand medical conversations better, it also helps you advocate for yourself and others. Knowing which doctor to go to means you don't waste precious time visiting the wrong specialist or waiting in the wrong clinic while your condition goes unaddressed. There's also something deeply empowering about this kind of knowledge from a language learning perspective. Medical vocabulary is one of the most challenging areas of the English language, not just because the words are long and technical, but because mispronouncing them can lead to real confusion. Words like gynecologist, obstetrician, and orthopedic surgeon are not the kind of terms you encounter in everyday casual conversation, which is exactly why so many people stumble over them. But now that you've gone through this lesson, you have both the meaning and the pronunciation down, and that combination is what truly builds confidence when speaking English in a medical context or any professional setting. So let's do a quick recap of everything we've covered, because going over it one more time will help lock it all into memory. A general practitioner or family doctor is your first stop for common, everyday health concerns. A dermatologist handles everything related to skin, nails, and hair. A dentist takes care of your teeth and gums and should be visited at least twice a year. A cardiologist is a heart specialist who treats cardiovascular diseases. A gynecologist manages female reproductive health, while an obstetrician performs surgeries in that same area. An optometrist is an eye doctor who helps with vision problems and eye infections. An orthopedic surgeon deals with bones, joints, and the skeletal system. A pediatrician is dedicated to the health of infants, children, and teenagers. A urologist focuses on urinary issues and male reproductive health. And finally, a neurologist treats conditions of the brain and nervous system, while a neurosurgeon steps in when brain or spinal surgery is required. Now that you have this full picture, here's a small challenge to test yourself. Think about the following situations and decide which doctor you would visit. Your child has a high fever and has been unwell for 3 days. You've been having sharp chest pains after climbing stairs. You've noticed unusual hair thinning and scalp irritation. You recently twisted your ankle badly and the pain hasn't gone away. You've been getting frequent headaches and occasional blurring of vision. Go through each one carefully, apply what you've learned, and see how many you can get right. This kind of active practice is one of the most effective ways to make new vocabulary stick for the long term. Learning the names and roles of different doctors is far more than a vocabulary exercise. It's a life skill. The next time you or someone close to you needs medical attention, you'll know exactly where to go without hesitation or confusion. You'll be able to communicate clearly with healthcare professionals, understand what's being discussed, and make informed decisions. And if you're learning English, this is exactly the kind of practical, real-world language that gives you a genuine edge, not just in exams or classrooms, but in actual situations that matter. Keep building on what you know, stay curious, and remember that every new word you learn is another tool in your hands. We'll be back with more lessons just like this one, so keep practicing and keep growing. Sonnet 4.6 Low.